You're welcome again. We want to talk about various essential test screening for women. We've been able to discuss the female essential test screening. And some of them too, they are age-specific screenings. When you are between 20 to 35 years, you need blood pressure check. You need product. Hypertension, some people say is a silent killer, and that is it. It can kill. You have to check your cholesterol. Your lipid profile is very, very important. Your blood glucose test to detect pre-diabetes or diabetes or something. And you have to check your body mass index. How big are you? The BMI calculation, your doctor should be able to do that for you. Then there should be testicular, that's your testes, self-examination. You should do that. Then your vision and hearing test between age of 40 to 60 years. It is very, very important to have your vision and hearing checked. Then by that 40 to 64 years, you need specific antigen. That's PSA, prostate specific antigen. You need it. Then digital rectal examination, colonoscopy to every 5 to 10 years, which is very important to know if there's anything. Your colon is the large intestine. And they want to know if there's something, maybe early stages of cancer or something. Then you need the electrocardiograph, that's ECG, to know how your heart is functioning. Then of course you need blood test. You need blood test for liver and kidney function. We want to know how your kidney and liver are functioning. Then by the time you're 65 plus, you need annual prostate examination, both the PSA and the DRE. Then you need annual colonoscopy for the colon. Then you need your bone scan. That is, there's something we call osteoporosis. When there is demineralization of your bone, you need to check if there is problem with that. Then your cognitive function, how do you relate? Are you still okay? Are you oriented to time, place, and person? We don't want to know. They want to check your cognitive function. Has it declined? Is it okay or something? Then we have to do depression screening. Depression is very, very important. Your mental health status, we want to know. Then additional screening, number one that we need to do is HIV testing if you're still sexually active. You understand? Then number two is sexually transmitted infections. Sexually transmitted infection, they are so numerous. You understand? We want to do that. We want to do hepatitis C screening, especially for those people born in between 1945 and 1965. Most of us that are alive now, that we're still younger, they have done that. We have taken the vaccine and all that. Then of course, we need to do skin cancer test. Your skin cancer test, and you're going to repeat your vision and hearing test. Cancer screening, we want to do prostate cancer screening for you, right? PSA, we want to do the DRE so that we know if there's any problem. We want to do colorectal cancer check, colon and the rectum. The screening is very, very important because all those cancer in those areas, they are not easily gotten. You understand? By the time, most of the time we get them. So, but early testing can discover. Then of course lung cancer screening we want to do, low dose CT scan for lung cancer. Skin cancer screening is very, very important for you to do. Don't wait. What I preach is preventive health. Your mental health screening is very important at this age. We want to do your cognitive function test. We want to do your depression test. We want to know if you have anxiety disorder. We want to know if you have anxiety disorder. We want to screen you. We want to screen you for substance abuse use. You understand? It is very, very important if you have issues like that. And all that we want to do, water screening, we want to know sleep apnea, we want to do your erectile dysfunction. Erectile dysfunction screening, just to know the reason. The erectile dysfunction is when the penis could not even, is not erecting at all for action. We want to do your cardiovascular diseases, the stress test, the ECG, and know almost all the tests we want to know. And the recommended frequency for some of them is annual physical examination. Some of them are quarterly examination. Some of them are biannually, that is twice a year. And it is not bad if you can get your own blood check apparatus, blood pressure check apparatus. You can get your own sugar apparatus. Then quarterly lipid profile, that's 3 months. So the dental examination is annual examination. The annual. The vision and hearing test, they are annual too. You understand? And there are some risk factors we want to consider before we do it. Number one, your lifestyle, smoking, alcohol, your family history, your BMI. That's if you are obese, maybe it's severe obesity or something. Maybe you are not physically active. Your high blood pressure, if it's at risk. Your high cholesterol, if you are a non-diabetic patient, or previous medical condition or previous surgery. You understand? Those are the things we want to take into consideration. We just don't, you just don't leave your body and think you are okay. It is very important to do all these things. If you have learned one or two things from this, kindly subscribe to my channel. See you in